on youth and mental health. So if you'll be kind enough to sit down, and I will introduce Jürgen. Okay, so it's a pleasure to have Jürgen with us. He's a policy officer in DG Senko, so probably most of you know DG Senko for the European Union, and he's responsible for mental health and dementia. So Jürgen, it's yours.
Here, now, yes. Okay, good afternoon. Thank you very much to the organizers, to Professor De Girolamo for inviting me to speak. Indeed, I am working for the Health and Consumers Directorate General of the European Commission. We are, well, it's the middle of the conference, so I'm going to make references to things that have already been said, but I'm also going to refer to presentations that will follow mine. I will try to avoid too much duplication of things that would be said. And I would like to begin with, or I would like to give to you a short overview of activities that we are doing and have done in the field of mental health at European level. And I would also like to inform you about plans for the next year that we have. Having said that, of course, this takes place in a context of work on mental health at European level since quite a number of years now. And the objectives of that work are the key objective is to support member states who have the responsibility for managing their mental health systems in their work. And the objectives that we have defined for this in our work at European level is, on the one hand, to help member states in strengthening mental health services for common and severe mental disorders, including through developing the dimensions of promotion, prevention, and treatment and support and self-management, but also, and that in addition to develop partnerships between the health sector, health systems, and other sectors, in particular workplaces and schools, in order to raise their commitment to mental health as a contribution to improving the mental health of the population, but also because such action will help these actors in achieving their core objectives like productivity and raising educational attainment. There is already a continuity over several years of action at European level. And I would now like to refer to the launch of the European Mental Health Pact, an informal agreement to work together on mental health challenges and opportunities between member states and non-governmental stakeholders. And also, and in order to implement that, we had a series of thematic conferences during 2009 and 2011. Then that has been followed up by the launch of a so-called joint action, a collaboration between 25 member states plus Norway and Iceland, which was launched in 2013. I'll say a little bit more about that. Then we had in 2013 an official EU presidency conference in Lithuania, and we have developed a tool to collect good practices, the European Compass for Action on Mental Health and Well-being. So, just very briefly to start with a few context statements. Of course, most young people in the EU enjoy good mental health and well-being, but there are a number of them who experience mental health problems. In fact, the risk factors have increased through the crisis, through increasing pressure at schools, through growing uncertainty about future for many, and difficulties in the transition into work. All this creates more risks for the mental health of young people. mental health problems are an important precursor of such problems in later life. At the same time, services do often not meet the demand, although we have heard that significant differences exist between countries. And then promotion and prevention are increasingly recognized as priority by member states, but they are usually not yet mainstreamed and often underfunded. And we have, as regards data on the level of mental health in countries, we have set up a project some years ago, which is led by Vivian Kovesh, the project School Children Mental Health in Europe. Vivian is going to present a few data to you later today. And in fact, some findings that I would like to refer to were that in those 7 countries that were addressed, that 4.4% of children experience mental health problems requiring psychiatric care, ranging between 5.7% in Lithuania and 3.2% in Italy. 68% of these children were not in contact with any health professional. 64% were seen by a general practitioner and 42% by a pediatrician, and only less than 20% were seen by a psychologist, psychotherapist, or psychiatrist. This is a slide that Matt Mullion had already shown to you, showing the burden of disease caused by mental health problems already in young age and over the life course. This is another figure which is more about the consequences of such problems. It's taken from the Netherlands. In fact, it's taken from a report which the Dublin Foundation had prepared 2 years ago about the active inclusion of young people with disabilities and health problems, where one focus had been on mental health problems. And the slide shows you that intellectual disabilities and psychiatric and behavioral problems are accounting for the greatest share of young people that enter into disability benefit schemes in the Netherlands. So already in young age, they face disability because of mental health problems and cannot work for that reason. Some further recent developments, one from Germany, that there the number of inpatient mental health treatments for young people with depression has increased by the factor 6 between 2000 and 2012. And in Denmark, another figure on the number of young people who are entering into disability schemes because of mental health problems. That's a figure from 2007. Their mental health conditions accounted for 46% of these. Now, these are, of course, snapshots about the situation in countries. The question is, what do countries about this? We've tried to invite better information through a report which was published 1 year ago. The full title is a very long one. It's mental health profiles. It's about mental health the profiles of mental health systems and situations in member states, and the acronym is Europop report. It has been prepared by Chiara Samele with a team of partners. So, and this report included profiles of each European EU member state, where these described the legal framework, the services delivered to people with mental health problems, and also as a priority it described mental health promotion and prevention activities in these member states. And the report shows that in many member states, actions for mental health promotion and disease prevention are included into mental health policies and strategies. So they are mentioned here. Italy has included mental health in its national prevention plan. The Netherlands is encouraging people to make healthy life choices. Norway, Slovakia, Slovenia, and UK are further examples where this is described in the report. There are a few countries, however, which do not yet put very strong priority on health promotion and disease prevention in mental health. For instance, a statement in this